cannabis therapy, we know in the laboratory, can slow the progression of Alzheimer's type plaques that develop in the brains of laboratory animals. Now, we don't have clinical evidence in humans yet, but there's some very promising laboratory evidence to suggest that the progression of Alzheimer's can be slowed by using THC. We also know that alpha-pinene has been shown to slow some of the progression, and in the laboratory at least, it's very promising.
So I didn't mean to cut you off there. So I know the studies are showing laboratory, and you want the laboratory results. What about your own personal experience? Have you had any personal success with cannabis and your patients?
In terms of slowing progression of the disease, I haven't seen that in my clinic yet. We've only been open about 2 years since Amendment 2 passed in Florida.
That's right.
And in order to see a change in progression, you need at least 2 or 3 years.
Okay.
Because the slope of the decline is slow.
Okay.
And it's hard to see that you're changing the underlying process within a year or two. Sometimes it takes longer to really see the change in the slope. As far as treating symptoms, though, when it comes to treating symptoms, we are seeing success in the cannabis clinic using certain terpenes like myrcene, which is a sedative and helps with agitation and restlessness, helps with sleep. We're also using alpha-pinene, which helps increase the level of alertness and reduce short-term memory problems. So using those two terpenes, myrcene for nighttime and alpha-pinene for daytime, we are seeing some benefits.
And so with these terpenes, I'm certain our followers are thinking, where do I get these terpenes? Is it in the product that they're already purchasing at the dispensary? What if they live in an illegal state, they don't have access to this? Can they just go out and purchase separate terpenes, as we spoke about earlier in the symptoms lesson regarding essential oils? I carry a bottle of lavender in my briefcase, and that's for calming. And so what can you recommend for our listeners?
If they're living in a legal medical marijuana state, I believe the best way to get those terpenes is as part of the whole plant.
Okay.
So that the other terpenes and the cannabinoids that live in that flower are working together in a way that we may not understand. So nature put those terpenes there with those cannabinoids, and that flower is living and is going to be helpful medicine to us as a whole. Okay. So if that's possible, I believe that's the best way to get those medicines.
What I've always seen with the patients that we work with Alzheimer's is THCA. And I know you have mentioned quite a few times about THC with your patients. And can you share any stories or successful stories or unsuccessful stories with using one or the other or both?
Well, in our clinic, we are using both.
Okay.
But we don't have the large number of patients with Alzheimer's over a long period of time to watch the effect. Okay. As well as someone like Dr. Hergenrather, who's working at I believe it's the Primrose Assisted Care Facility in California. So he's using THC and THCA, along with CBD and other terpenes, in addition to the cannabinoids, and monitoring these patients over a longer term. So we're looking forward to publication of those results. In our clinic, we have short-term wins with behavior. We have not been able to see much of a change yet in the progression of the disease. We know that THC and THCA reduce the accumulation of amyloid plaques in preclinical laboratory models, and that's great. We need to try and see if that's going to happen in humans, and that will take several years at least of research. When it comes to treating symptoms, however, we can see more of an immediate benefit, and we can know more quickly whether or not that treatment is having a positive impact. With Alzheimer's, it's important to determine who's going to give the medicine in addition to how much they're going to give, because we want to have a reliable dosing schedule. It's easy for someone with memory difficulty to make a mistake with their medicines, clearly. Yeah. And so if you have a caregiver that's willing or able to specifically dose the medication, we usually start out with a very low THC product, really just 1 or 2 milligrams as a tincture, for example, or maybe 10 milligrams, which is in a patch that's provided over 2 or 3 days, which is exceedingly small, but it's convenient and unlikely to cause any problems.
Okay.
You know, you don't want to make any problems.
Yeah.
So starting with a very small amount of THC along with CBD, you need both, and then increase that from once a day to 3 times a day over, let's say, 3 weeks. That's a typical protocol.
Gotcha. I am a fan of those patches, by the way. But I was always told not to put them on your shoulder like you would a Nicoderm, as a Nicoderm patch, but on the inside of your wrist, back of your neck, on your ankles. Are you seeing something different with that? 'Cause I know you pointed to your arm, just to point to your...
So the distribution of the medicine is becoming much better.
Okay.
So when you put a topical medication in a vascular area, like the inside of your wrist, you're going to get that absorbed into the blood vessel and into the circulation much more easily than putting it here on the shoulder. However, the technology of these medications is getting quite good. And so you can now put a patch in an area like the shoulder or the back, and it will get absorbed, and the medication will be as effective.